I want to thank President Meehan and Chancellor Subaswamy and also the UMass Alumni Association for inviting me here today. After reading through the many past recipients and meeting my co-recipients today, I'm very humbled to receive this award. I'd also like to thank my longtime friend Rick Gentile for nominating me for this award and for feeling that my work was on par to receive such a great honor. I have the dual honor of being both a graduate from UMass Amherst and also a graduate of UMass Medical School. I'm also a faculty member at UMass as well, and on the Worcester campus, we're fondly referred to as UMass lifers. If someone had told me upon entering UMass Amherst that in 30 years I'd be working in Africa in the middle of an Ebola epidemic, I would have thought them quite mad. But looking back through the years, I can see that my medical career and my humanitarian approach to medicine stems directly from the education and mentorship that I received both at UMass Amherst and at UMass Medical School. As an undergraduate and biochemistry major at UMass Amherst, I received the foundation that I needed to achieve my dream of attending medical school and becoming a doctor. As the first member of my family and extended family to attend medical school, this was a tremendous source of pride for my parents and my family. At UMass Medical School, not only did I receive a first-class medical education, but I met many role models who exemplified the best types of physicians that have inspired me to become an excellent physician. They were compassionate and interested in caring for underserved populations and providing much-needed primary care. As a faculty member at UMass, I've been given the flexibility to develop a career that I'm passionate about and combines so many of my interests, working with children, teaching and mentoring medical students and pediatric residents, and working with underserved populations. I've been able to combine all of these interests by working in the field of global health in countries such as Liberia, Haiti, and India, and to help to improve child health through research and education. Most recently, I participated in a countrywide public health intervention to help contain the Ebola epidemic and save healthcare workers' lives. I would like to point out that during the epidemic, when many academic medical centers were circling the wagons and not allowing their faculty members to travel to West Africa, UMass Medical School extended a helping hand to Liberia in the form of a $7.5 million grant from the Paul Allen Foundation and allowed several of us faculty members to jump in and aid our Liberian colleagues who were just desperately in need of help. I'm very proud of UMass for the role that it played in this critical time. I did not get to this point in my career alone, and I'd like to thank the many people who helped me get here. First, I'd like to thank my mentors, without whom I would not be here today. Many of you may remember Dr. Brian O'Connor from UMass Amherst, who was my pre-medical advisor and who helped so many of us get into medical school. He encouraged me from day one and made me keep trying. I didn't get into medical school the first time I applied, and he was behind me 100% of the way and made me realize my dreams. I also remember a mentor, Dr. Ed Westhead, who is a biochemist at UMass Medical School, and he was somebody who encouraged my research interests, and that's something that I have developed a lifelong career in as well. Next, I'd like to thank the many mentors and role models that I had at medical school. Doctors like Linda Sager, who's here today. Linda's the new medical director at the Department of Children and Families and has a lifelong interest in working with foster children. She and many others at UMass gave me the flexibility and support to develop my career in global health. Thanks to the McQuilkin clan, Paul, Jack, and Jane, Steve, Mary, and Paul Hosford, also Amy Mullins, who is a graduate of UMass Amherst as well. Thanks for always supporting me through all that I do. I wish my mom and dad could be here today because the work that I do is truly based on the principles that they taught us when we were growing up. They were so proud when I graduated from medical school, and I know that they would be proud today. I also want to thank my father-in-law, Erwin Fishbein, for traveling all the way from New Jersey to be here today. Lastly, I'd like to thank my immediate family, my husband, David, my sons, Sam, Josh, and Eli, who allowed me to travel even though it was extremely difficult at times, especially over the past year when I was traveling back and forth to Liberia, and there was much fear and stigma attached to traveling to West Africa. They truly share this award with me today. Again, I thank you to the Alumni Association, to Rick, and for all of you for your recognition and support of my career and for this wonderful award and celebration.